We're just here to answer any questions you have.
Well, the most important one, I got you right away.
I know you're right on the state fish. I know you're on the
Who's
state
gonna
fish.
win the Super Bowl?
The Patriots are going to win, and I was on a panel down in New York with Governor Cuomo, who was making a big push for the other team, and I tried very hard to stay out of the discussions, and I finally got lured into it, and I just said, last time I checked, I'm a governor from New England, unlike Governor Cuomo, and I believe that the New England Patriots are going to win. That's my prediction.
What's the score?
I'm not going there. Not fair. That's not a fair question.
Would not commit to score.
Thanks for coming.
Are you going to the Super Bowl? I heard you went to one of the playoff games.
You know, I actually wanted to go to the Super Bowl, as most Vermonters do, but I can't. I'm working too hard in Vermont.
Did you go to one of the playoff games?
I did. I went to the game, the Denver game, and the New England Patriots, showing what they can do on Sunday, scored within 14 seconds. When the score got to be 40-7, I decided it was time to head back to Vermont.
Do you have would you make a request of J. Wayne Leonard to pay his own legal bills? Attorney General bills will be quite exorbitant. You have, I guess he's pondering, he said in his conference call yesterday he was pondering sending a bill. Do you have any thoughts about that?
I do, but I'm not going to share them with you. You know, I'm going to be very circumspect about talking about Vermont Yankee in light of the fact that it's being litigated and we are still deciding exactly what the state of Vermont's going to do next.
What about their motion yesterday to take it back, to have the Public Service Board rule? What did you make of that?
You know, again, I'm not going to say much. All I will say is that their motion is a little puzzling in that they request of the board that we ignore any actions at the plant that took place over the past 2.5 years. And I personally think that what's happened in the history of the plant throughout its life in Vermont is relevant to the decision about the future. And obviously we know that in the past 2.5 years, there have been a number of incidents from the leaking pipes that they swore under oath to the board weren't there, to the spinoff to Nexus and other events that certainly would seem relevant to Vermont as the board contemplates the plant's future.
The decision, getting pretty close. A decision on appeal or not?
We will make the decision within the 30-day time frame as outlined by the requirements.
We saw some tweets that there was a secret meeting with Yankee advocates. Any reason that wasn't more public?
I don't have secret meetings. I have lots of meetings with lots of people. I don't consider any of them secret. My goal is to listen to as many Vermonters as I can about the issues that I'm expecting to make decisions about as a governor. And Vermont Yankee is no different. So I've had a number of meetings with people from all walks of life about the future of Vermont Yankee and how the state might best move forward. As you know, the decision about whether or not to appeal is made by the Attorney General. He's been good enough to consult with me and legislative leaders, and you'll know our decision when the Attorney General has made it.
If you've met with the opponents of Vermont Yankee, have you also met with supporters or businesses that have traditionally been supported?
You know, I speak with people on both sides of Vermont Yankee every day, and I want to hear as many opinions as I can on the subject, and I have been.
So if it wasn't a secret meeting, what did you guys talk about?
Well, I'm not going to comment on what was talked about. I'm just saying I have meetings in my office sometimes all day long, and they're not secret meetings. Governors meet with people to figure out what people are thinking, hearing, and what they would wish their governor to do.
Did you ask participants in that meeting not to talk with the press about what you all discussed?
I make clear to anyone who I talk to about Vermont Yankee that, first of all, I'm not going to say much about what I think, which I know is uncharacteristic of Pete Shumlin, but my staff is proud of my discipline, I think, as well as the fact that it's helpful if there's not a lot of signals to Entergy Louisiana about what our next move might be.
As you contemplate the possibility of appeal, does the possibility that Vermont might be on the hook for all these legal fees, which we're told is going to be millions and millions of dollars, does that become a factor in the decision whether or not to appeal?
You know, we've talked about that before. In terms of the cost, our first priority is to do the right thing for the taxpayers of the state of Vermont and to ensure that any action that we take is in their best interest. When you make a decision like that, you enter all kinds of factors into your decision. And as a fiscal conservative, cost is one of them, but there are many other decisions you enter in. So to suggest that we don't consider cost wouldn't be correct, but the most important decision we make is what's in the best interest of Vermonters and how do we get the result that we want.
I was thinking not only the cost to the state, but perhaps the Entergy's legal fees as well for the trial that's already been held this week and going forward. I mean, the state of Vermont could be on the hook for the whole thing.
Sure, but I just want to point out this is how the system works in America, and this is how the system works in Vermont. And as I've said before, the Attorney General's office has brought in this year alone roughly $40 million from winning suits. They win some, they lose some pay in, some pay out. It's important for taxpayers in Vermont to know that the Attorney General's office has brought in a lot more money than they've paid out.
Later today, there's going to be a press conference on the autism mandate. So remind me why you don't support having autism services covered by Medicaid or private insurance companies in Vermont mandating the private insurance coverage.
Well, you know, I should point out that I do support it, that I voted for it when I was in the Senate. The challenge we have is balancing the budget. And as you know, this is a new program that we're implementing, and we have requested delaying that program until Vermonters can afford it. We're working very closely with the folks in the autism community to try to fashion a compromise that might have a narrower financial impact on our budget and still accomplish our goals of wanting to take care of all of our kids in Vermont. So it's a work in progress.
What would that compromise look like? Some
Well,
limited spectrum of services or what?
Too early to say. All I can say is that, you know, I feel strongly that Vermont should be taking care of kids with autism, just as we do with so many other challenges that kids have, where we can and in a way that's cost effective. And I think that's what we're going to try to work together with the community to work out in the weeks and months ahead with the legislature.
So you voted for the mandate. Wasn't it the private insurers mandate repealed last year?
Yes, for budget reasons.
The revenues in the year that you passed this mandate were lower than this year. So why, now that revenues are higher, how could you be?
Right. This is an example of legislation passing when, truthfully, this is now 3 years ago, 2.5 years ago, where we didn't really understand the cost implications to the state when we passed it. And it turned out that the cost implications, the way the language was written, were much more severe than any of us thought when we voted on the bill. So the truth is, the information that we were given about the cost wasn't accurate, and we're working together to try and come up with a solution that's affordable for Vermont taxpayers and takes care of some of the greatest needs of our kids living with autism.
So you're considering, I know there was $10 million, the state cost was going to be $10 million. Are you considering, as you work with these folks, adding some of that money back in, or?
We are trying to find a solution that solves the problem and doesn't break our budget.
Are you disappointed that 3 House committees have approved a plan for 25 beds for the state hospital, not 16?
Well, you know, let me first say I think the House has done excellent work on our plan to deal with the crisis that we're facing right now, which is a state hospital that got flooded out in the middle of the night and a cobbed together delivery system that keeps me up at night. And because, as you know, we're working with not enough beds right now. But I'm heartened by the fact that they have endorsed our community-based care, that they've endorsed the beds in Brattleboro, they've endorsed the beds in Rutland, and that they've endorsed the construction of a new state hospital. I'm also glad that the Senate can have an opportunity to weigh in on this topic, and I very much hope and expect that the Senate will pass a 16-bed facility as requested by my administration. The reason this is so important is we believe that we have designed a community-based system that's going to deliver the best quality care for Vermonters suffering from mental illness of any of the other states in the country. We think the right number is 16 to deliver that care and have a community-based model where patients suffering from mental illness don't have to travel, halfway across the state to get acute care beds. So we think we've vastly improved the plan that we were living with in a old state hospital that, in my judgment, should have been condemned a long time ago. Having said that, we all know that if you build a new facility of more than 16 beds, there is no example that we've been able to find in the country where the federal government reimburses for a larger facility than 16 beds. If you look at it in Vermont, on a 25-bed facility as the House passed, it would cost Vermonters about $9 million a year if they rejected our federal match, which over 20 years is $180 million. As someone who is very concerned about Vermont taxpayers being able to pay the bill in tough times when they're struggling, I personally think that that would be fiscally irresponsible.
Now, I've heard some mental health professionals say that this really is just about, in their opinion, just about saving money with federal government reimbursements. They say that the federal government won't reimburse larger than 16 beds because they think states should pay for state hospitals. Should it be on the state?
I think that interpretation is penny wise and pound foolish. Listen, the federal government for most of the states pays 60% of the bill. Vermonters have been paying that 60 cents out of their tax dollars for the last decade because we haven't had an adequate state hospital that the federal government will certify for good reasons. It was old, tired, and worn out. So our responsibility now is to design a delivery system that, number one, puts patients first, which we believe that we have done, and number two, draws down as many federal dollars as we can so that we don't ask hardworking Vermont taxpayers to pay the entire bill. So this is just, the beauty of our plan is that it's great delivery of care, I think the best in the country. It allows for more diversity so that people can get more even acute care beds in their local community. It finally delivers on Vermont's promise of providing quality community-based care where people want to be treated, which is close to home. And finally, it's fiscally responsible. 25 beds is not.
Wouldn't the federal government pay the cost of a 25-bed facility if the global commitment waiver is renewed?
We do not know the answer to that question, and it's not a risk that I'm willing to take. Some have argued that if the global commitment were renewed, the federal government might be required to pay the bill. I don't think it would take tremendous imagination by a bureaucrat in Washington to say, we're renewing your global commitment. Whoops. Who lost it? Is that yours? Yeah. Oh, it's your old mic. You're kicking around. It wouldn't take a tremendous amount of imagination for the federal government, a bureaucrat in the federal government, to say we're renewing your global commitment, but you have to comply with the same rules as all the other states when it comes to new facilities, and we're not going to reimburse you in your dollar amount for a facility that doesn't meet our requirements at CMS.
So what if the House passes a bill with a 25-bed facility? You try to cut it back in the Senate?
Yes.
So when your administration says to the House plan, it's something we can work with, you mean we'll get a change in the Senate?
Yeah, they've done great work. They've agreed with 99% of our plan. We do disagree on a number of beds, and we expect that the Senate will do the right thing.
What's the estimate for when this facility is up and running? Do you guys have an estimate? I've heard it's rather long.
I'm going to do listen, there's two issues here. There's been a number of press reports in the last few days about folks in the field concerned about the fact that there aren't enough beds, or that adequate care, ideal care is not being granted to patients suffering from mental illness in the state. As you recall, what I said in my budget address is, we're in a crisis. It's incumbent upon the legislature to pass a bill by February 17 so that we can start to invest in the beds that we need so that we're no longer in crisis management. This keeps us up at night. The answer to your question is, we can build the Brattleboro beds and the Rutland beds almost immediately. We will build the new 16-bed facility as quickly as we possibly can.
But what's the estimate? I've heard 40 months, 48 months. That's pretty long.
None of us know the answer. All I can tell you is that as governor, I'm going to push the envelope on construction the same way that we pushed the envelope on the Crown Point Bridge. And many people said when that bridge went down, it would be down for 5 years. It was down for 2 because we worked together to cut through bureaucracy and red tape. We're going to do the same thing with our state hospital.
Does BGS have an estimate?
No. We won't have an estimate until we get approval for the plan. Then we'll do the drawings and get it built as quickly as we know how.
When you say it keeps you up at night, what, are there specific risks you've heard about, specific cases where there's close calls?
Absolutely. We are.
Can you describe some of that?
Well, I think the example that probably most folks would share as a concern was the holiday weekend. The holidays are traditionally a time when you have a lot of demand for mental health services. It tends to be the busiest time. Over the Christmas holidays, we had so much demand that we were really, we ran out of beds. We managed to find a place for everybody to go, but when the sheriff from Windham County says that we were putting a patient at Brattleboro Hospital and asking his folks to stand watch, he's right. That's not a situation we wanted to have to do. We had to. So there's an example of crisis management. We think we're doing it as well as we know how, but this is not an ideal situation. I'm very concerned about it as governor. We need to move a bill by February 17, and we need to start building beds so that we're not managing from the seat of our pants.
Would we be out of that crisis situation with the short-term solutions in Brattleboro and so on? Or is that a kind of situation we're talking about for several years?
No, if we could build out the community-based system, which as you know is a big part of our delivery system, and build out the beds in Brattleboro and Rutland, we believe we would not be managing in a crisis situation. We still would wish we had 16 more beds, but we would be in much better shape.
And the BSEA released a video of you as a senator saying that 15 beds will never work and that working with hospitals will never work. Why has your opinion changed?
Well, I think it's important to remember what I was talking about on the video. I opposed the 15-bed facility at Waterbury. You might look back on that now and say this governor actually has some foresight. I opposed it because it was being built in a floodplain, and because in the location it was being built, it could not be expanded. I think that is penny wise and pound foolish, and the first thing I did as governor was kill that proposal. I'm glad I did, because it would have been under construction when Irene hit, and we all would have looked pretty silly, spending millions and millions of dollars building a facility that can't be expanded in a floodplain in Waterbury. So they're correct. I said that the 15-bed facility that was proposed, passed the legislature and signed into law by Governor Douglas would not ever work. I killed it as soon as I became governor. I've now proposed a plan that will work because we are building other beds, 10 in Brattleboro, 6 in Rutland, a community-based delivery system, and a facility that can be added on to if we're wrong. So, for a lot of reasons, I made the statement that I did because I really opposed that plan.
Vicki?
Sorry, what about the nurses at Fletcher Allen that have spoken up this week saying they're afraid at work? What sort of protection is being offered to them?
Well, we're doing everything that we can to manage, and as I just acknowledged, it's a crisis situation. And I'm incredibly grateful to our healthcare delivery workers who are doing an extraordinary job of dealing with a mental health crisis. And I said it in my State of the State. I meant it. We are very concerned about the fact that we don't have an adequate delivery system right now. Our healthcare workers are under tremendous stress. The administration's under tremendous stress. It's incumbent upon the legislature to get me a bill by February 17 that allows us to start building out the community-based system that's going to solve our problem.
So will anything change for the nurses at Fletcher Allen in the near future?
As soon as the bill is approved, we're going to start building beds.
What's the magic of February 17th?
You know, I picked that date as what I thought was a reasonable time that the House and Senate could give due diligence to a really complex issue that frankly this legislature struggled with for 20 years now, and get a bill on my desk. And you know, I think they're doing very well. I'm proud of the House for the work that they've done. I look forward to the Senate moving forward. I know Senate President John Campbell intends to move that bill as quickly as he can. Might not be February 17, it'll be close to it, but I know that they're focused on getting it done.
Governor, have you talked to the folks at Fletcher Allen and something like that at the center to see if they would be willing to build permanent beds in those two locations that you know, could add to the 16 that you want?
Well, we've had extensive conversations with Central Vermont since the crisis happened at Waterbury as well as Fletcher Allen. I want to make the point that Fletcher Allen has a very, very good psychiatric facility and will continue to within this plan. They offer mental health services to mostly patients from Chittenden County in crisis, and nothing in our plan changes that. So I've been a little puzzled by some of the discussion that somehow Chittenden County isn't going to have care. Chittenden County has great mental health delivery care at Fletcher Allen right now. They will continue to after our plan is implemented. They're playing an integral part in our delivery system, and we have a lot of confidence in their work.
I guess the question I have with that is whether or not you know, they're willing to take Medicaid patients, and that's really what one of the hospitals will do to an extent, taking in patients that no one else will take. And so I just wonder, you know, why they aren't willing to do that, particularly since they have a teaching hospital there in other parts of the country. There's a marriage sometimes between a state hospital and a teaching facility, and just wonder why we don't have that kind of relationship.
You know, all I ask is that when we talk about the system we're proposing, we ask this question: is this a new problem or a new challenge, or did it exist before Irene flooded out our state hospital? Fletcher Allen will be playing the same role that they played pre-flood. They provide extraordinary mental health psychiatric services to people in Chittenden County. We're going to have a community-based delivery system that backs up those services, and we're going to have a great system. We should be really celebrating the fact that the House has passed a bill that's going to finally put Vermont on a road to a mental health delivery system that puts patients first, really finally delivers on community-based quality care, and has acute beds in a variety of locations when patients need them close to their homes.
Can we talk about another one of your favorite topics, property taxes?
Sure.
I was wondering, you know, at this point, all the girls in the sent you a letter apparently asking whether or not you think we should increase property taxes because it looks like schools are coming in higher than anticipated in their budgets. And I just wondered what your response might be to that.
Well, you know, I think it's really important to remember the facts. Vermonters are struggling to pay their property taxes right now. Everybody in Vermont understands that local communities, local control is a good thing. I support it as governor, and Vermonters will decide on town meeting day whether to pass or reject their school budgets based upon those that have been presented by their local school boards. If they raise spending and choose to do so when they vote on town meeting day, taxes will go up. If they don't raise spending, taxes won't go up. This notion that Montpelier controls property taxes is misguided. Local communities decide about their local spending. The beauty of Vermont is that with our school funding formula, we provide equity. Every community has the same access to resources under Act 68. You don't have to be property wealthy to be able to make the same choices as the communities next to you. So we all know how it works. If local school boards come in with budgets that are too high, I think they should be rejected because Vermont taxpayers can't afford to pay higher property taxes. I've urged them to level fund their budgets. They must do so. I'm sending the clearest message I know how school boards have a responsibility with dwindling enrollments in Vermont and dwindling staff size to level fund their school budgets this year, just as they have for the past 2 years.
So you don't think the tax rates were going to raise the statewide property tax by, say, 4 to 6 cents once once you build in the basing issue?
If school boards increase their spending locally, and if Vermonters choose to increase spending locally, their property taxes will go up. If they don't, they won't.
But in some cases, communities are raising their spending and
They're-
their taxes are still.
I understand that the school funding formula is complex and there's an exception to every rule. But on average, if Vermonters freeze their spending, their taxes will remain the same.
Well, if it's good for the schools and towns to level fund their budget, couldn't we say the same thing about the state of Vermont?
That's why we've worked so hard to trim spending over the last 2 years.
Yeah,
But your budget increase for next year is 5%, so.
Well, let's back up, Bob. Now, you know the school funding formula. We have a statutory requirement to increase a number of areas of state spending. One is our allocation to local communities to support school spending. Another is Medicaid and Medicare programs mandated by the federal government. So we do everything that we can to limit our spending given the mandates that we have.
Well,
The school boards don't have a statutory obligation to increase spending, as the
well,
state does.
They've got energy costs, they have healthcare costs, they have
Sure.
personnel costs, and don't they have the same kind of drivers that the state is facing in terms of their costs that are somewhat out of their control?
We all have costs that are out of our control. The school boards have done an extraordinary job of dealing with those costs for the last 2 years. We're asking them to do it again. My point is that they should have an easier time of it this year, because for the first time in recent history, staff numbers are dropping in our schools as our student count continues to plummet. That's good news, since we know that staffing is the majority of schools' costs. So all I can say is, on average, we're hopeful that school boards will level fund their spending as they've done for the last 2 years. They've done a great job. Keep it up.
So do you look at Burlington and say, what are these people thinking? They want a 10% increase in Burlington.
I think a 10% school board increase is too much.
Should school districts lay off teachers in order to meet this average increase?
You know, I think school boards have to, I'm not going to tell school boards how to write their budgets. They know how to do that better than any of us. They're good at it. My point is that we all have to understand that this is tough fiscal times that Vermonters are in, that Vermonters have not seen an increase in their wages over the last decade on average that's precipitous, and therefore school boards have a responsibility to bring in level funded budgets as much as possible. I personally think a double-digit increase is too high.
If you were a Burlington resident, you'd vote against it.
Well, I'm not a Burlington resident, so I won't answer that, but you just heard my message.
One of superintendents that have seen wage increases over the years and are contributing to the ed fund.
Back that one up, sorry.
What of the fact that several superintendents have seen wage increases and that's coming out of the ed fund?
I think, again, it goes right to the heart of the proposal that I made in my budget address. It makes sense for this legislature to look at consolidating superintendencies. It's one of the few things that we can do without hurting local control, so that we reduce the number of superintendents that we're paying in this state. And assistant superintendents is one of the places where we could cut $10 million a year from school costs by consolidating superintendencies into the 14 districts that we currently use for our tech centers. I think we should look very closely at that.
In some cases, doesn't this mean that some small schools will close? Because you've got a lot of really tiny ones across the state that are already sort of understaffed. And isn't one of the messages here that some schools might have to close as a result of further reductions in spending?
Well, I mean, can we just back up a minute to this future reductions in spending discussion? We've gone from over 100,000 students in Vermont to 83,000 or 85,000. We've had a precipitous drop in the number of kids that we're educating in this state. Taxpayers need to see that their taxes are actually dropping, their costs are dropping too over time. Now, we understand that it takes a while for the school boards to right the ship, but we should be able to deliver a quality education in Vermont for less money because our student count is dropping so precipitously. So let's not pretend that we're cutting budgets on the number of students that we have in our schools. We're cutting budgets because the number of students is falling in the state, and therefore it should cost taxpayers less over time.
But if you look at the population numbers, where the schools are that have the fewest students, they tend to be the most rural. So it seems to me that you're implying that perhaps some of these schools, shouldn't exist.
I am a big believer in small schools. I'm also a big believer in local control. And I think local communities can best make the decisions about what schools should stay open and what schools should close. If you really want to see a mess, ask Montpelier to try and decide where we should consolidate schools. I just think that's a decision that local communities should make.
When you talk about consolidating superintendents, are you basically saying you want to have larger school districts across the state?
That's correct.
And presumably some sort of district-wide school board that would be
The legislature has to work out exactly what makes most sense in terms of the governing body. I would think that you could reduce the number of people that currently serve on supervisory unions and do some consolidation there and get the result that we want. Listen, here's the best argument against the plan, is always, well, how do superintendents get it to enough meetings in a bigger district? My view is that between texting, Twitter, and email, we can electronically bring people together or bring them to the same meeting place in the community as is done up in the North Country, and have the superintendents move around to those board members if they meet on the same night in the same place. There's plenty of ways that we can be creative to save this $10 million, but we have more superintendents per capita than almost any other state in the country. It's one place where we could cut costs without hurting quality.
But following up on Ann's question, if you go to a larger district, isn't it almost inevitable that the group is going to look at some of the smaller schools and say, you know what, we as a region can't afford this anymore?
I think that it's really important that as you build the model for a consolidated superintendency, that you have equal representation between small and big communities. Then you won't have that problem.
What do you think about raising the age at which students can drop out of high school in Vermont? That's a bill that folks in the Senate seem pretty enthusiastic about.
As you know, I'm not a big believer that you can mandate behavior, that you can turn our schools into places where students are sentenced to be and to stay if they don't choose to. So if you really want to give teachers a challenge, require them to teach students who have been sentenced to school. I've never been a big believer in that. I think that the way that we get students, the way that we reduce our dropout rate among our teens, which is critically important, is to do just what we're doing. Have quality schools that teach to every student's learning style and result in one of the highest graduation rates in the country, which is what Vermont has right now. So I personally think we can do it without a mandate.
We have a low dropout rate comparably. Why is this a priority?
Of the legislature, you'd have to ask them that. I know.
You would say it's not?
I personally believe that the system that we have now works, and that if you sentence people to school after age 16, you're not going to get the results that you're looking for.
The Champlain Bridge seems to have some cracks. New York says don't worry about it. Should we worry about it? It's Harbor Bridge, and do we trust them? We
do trust them. Our engineers have confidence in New York's engineers. It's not unusual to have concrete have some cracks, particularly when weather changes, but they've assured us that they're not structural, and we believe the bridge is going to deliver New Yorkers and Vermonters to their destinations for many years to come.
Did it come up between the two states? I mean, was this something we questioned them over, or did we know about it?
You'd have to ask. I haven't asked Secretary Searles that question. All I can tell you is we have confidence in their engineers' assessment of the cracks.
So it's 40-7. You decide to leave the game. To go back to Vermont. Was the plane waiting? Was there did you
The plane?
Yeah.
No, I had 4 wheels. There was no airplane.
4 wheels.
An automobile.
All right. But was it a commercial plane that you flew back?
No, it was an automobile I flew back.
How does that work?
You have a driver and a key and gasoline in a mobile, and you drive it.
No kidding, you drove from, all right.
Gillette Stadium. Now,
Yeah,
I'm
yeah,
a
yeah.
Patriots fan, all right? I was there with Mr. Kraft, who owns the team, and the airplane, we drove on the highway. It did not fly in the sky.
Did you watch it from the owner's booth?
No, I wasn't invited to watch the owner's booth. I would have if he'd invited me.
Where were you?
I was in a booth. I was in a, whatever you call it,
Luxury
I
box.
don't know. I
a
haven't
box.
been in
Thank
one.
you. I was in a box.
Who's luxury box?
NRG Systems, not Systems. NRG Energy.
Like the Heinsberg Energy, or this is?
No,
Because there's another
it's a
one.
national energy
Yeah,
company.
Thank you.
Thank you.
Thank